So Carly started with me about 10 years ago. She came to me as a certified laser tech. She was barely 20 years old, and I just thought, there is no way, no way she's going to stay. And here we are 10 years later. She got 2 separate degrees in nursing. She's learned how to be an excellent injector. She's got quite the following. And she's also going back to school to be a family nurse practitioner. So always having new aspirations, always growth. I've got to be with her for all of her stages of life. Often people automatically think we're family or best friends because when they engage with us or the staff, they're like, are you guys related? Pretty much.
Yeah.
I think when you spend 10 years with somebody, you're family, period. So it's always important to me to get Carly's feedback and see, how she's feeling every day. And, her opinions matter. And so we're going to sit here and talk a little bit about our patients and how she feels about being here and why it matters to her.
I always say vanished raised me through my early 20s.
Amen.
My mid 20s, my babies. And now I feel like I'm still young, but
I think one of the things that we see, I see the most common of people coming into the practice from other practices, it's always that cookie cutter technical approach. Maybe they went for lip filler and somebody broke their heart and told them that they needed to inject, 5 other things. And they always try to train you on, here's how you sell the patient everything that they need. And I don't think we operate that way. I think first we want to know, what you're feeling when you look in the mirror and what you want to talk about, right? If you want an open-ended conversation, we'll give you an open-ended evaluation and treatment plan, but we've never been designed around selling anything.
Yeah.
But if we think it's not right for you, we call it like a filler timeout list or a no list.
Oh, 100%.
Or we will put people on we call it aesthetics timeout, because sometimes what they want to do is not what's going to be best for them. So I think that's what I admire about all of you guys, is that you kind of stick to that same belief system.
Agreed.
That we're here we really are here for the patient, and we're here for the best outcome, and we're here for each other. And it means a lot to me to have the same level of morality, across the board.
I agree. I feel like we all practice with a good ethical code.
For sure.
Throughout schooling and all of that, you're taught to uphold ethics. And I think there's a gray area in aesthetics.
Yeah.
100%. It's easy to fall, like we talked about, with the trends, or providers can just sell patients, but really treating as a whole and assessing patients as a whole, they're here for a reason. They're not here because they're sick, right? They're here because they want to feel better. What they see in the mirror, we probably don't see.
Well,
just like when we look in the mirror.
Yeah.
We
we're all
have
hard
our
on
thing.
ourselves. We're
100%.
We're all hard.
Which we need to be less hard on ourselves, but
And we try to teach that to our patients, that sometimes whatever you see in the mirror is not what everybody else sees. And so we have that conversation with ourselves, and we have that conversation with each other, and then we have the conversation with the patient, because sometimes we really need to talk them out of what they think that they see, because it's really important to us how people feel. The other crazy thing that I feel like I see a lot is the cheap, high concentration of hyaluronic acid fillers. So fillers have been demonized for a while, and I think justifiably so, right? Everybody's trying to get the cheapest product that lasts the longest, and what we're seeing is uneven breakdown. People aren't happy with the way things look. We go to re-inject and over top of it, and we can't hardly even get through the product to get to the tissue. So
pillow face even.
Yeah,
Too much filler.
which is a side effect of product selection and poor placement, which is why you shouldn't just go to anyone who can inject. People are going to parties, getting stuff done in environments where if you need something reversed, they don't even have access to that. They're opening single-use vials, in a salon and using it over and over and over again. And then what happens if you have a complication?
Yeah,
Who are you going to call? Are you going to go back to that provider? Are they going to drive all the way down to you? And I started out as an injector of parties, so it feels like a double-edged sword. Like, I hate to pick on people that's the way that they're conducting business, but the truth is, after knowing everything that I know, the level of risk.
Oh yeah. Well, aesthetics has evolved since
100%.
every year.
You're breaking the skin barrier, you're higher risk for infection, then you're doing it in an environment that's
Yeah.
unsanitary. So we see a lot. We
Yeah.
see a lot. And then, you know, with the wellness side, everything seems to cross over. Carly, since coming to work for me, has learned a lot about her body
Oh, yes.
and her health.
Yeah.
And it's always an ongoing
Oh, yeah.
evaluation.
Up and down. And I think a lot of women, even men, can relate to that, you know,
Absolutely.
especially if you've never been one weight your whole life or you've been in all the different sizes. I'm prime example of that, you know, and
Successful weight loss
Yeah.
and then regain and then
Yeah.
weight loss. Yeah.
babies, the hormones.
Well, let's talk about a little bit
Get to
about
know
men.
yourself.
Let's talk about the men in aesthetics.
Yeah.
Finally.
They're here.
They're finally
I
coming.
promise they come.
A lot of times it's the wives. They'll bring the husbands in because they got injected.
Yeah.
The wives got injected and they don't like their husband's wrinkles. They don't even know what they're getting when they come.
Yes.
They're like, I don't know, but my wife said I had to come
But I
here.
feel like we even have a lot of late 20s, early 30s
Preventative.
single men who actually now feel empowered to take care of themselves, you know.
Without embarrassment.
Yeah.
Right? Like they're not doing something that's only made for women. So we've
Yeah.
actually changed a lot of our website colors, a lot of our branding to make sure that it's you know, it's not so closed
No,
off. Because really we really do. We treat everybody, whether it's on the wellness side for like hormone replacement therapy, chronic fatigue, GI issues, autoimmune, or it's the aesthetic side. So then you have all of your skin treatments and your lasers and your injectables, and it's nice to see the changes in the diversity
Oh yeah,
for sure.
the world of peptides.
Oh boy.
I feel like that's really
That's the
brought
next
in.
generation, yeah.
That's
Yeah.
there's a lot of changes with that coming back to the trend.
Well, let's
but
make sure that we tell everybody, just because someone can sell you a peptide or you can buy it online does not make it safe. Should be prescribed, especially by somebody who's certified. I see
Yeah.
that all day long. Oh, let's just do some GHCKU for
Yeah.
your hair growth. Okay, did you do any lab work? Nope. Bought it off
Yeah.
some online
Check any
distributor.
markers.
Yeah, I've got plenty of pictures where people have brought me in peptides with particulates at the bottom, and it's contaminated. It's not even safe for use, and people are injecting that into their bodies.
wild.
It's Wild West out there, absolutely.
Even in aesthetics, Korean Botox.
Yeah.
Black market stuff.
Ordering it online and
Injecting.
self-injecting, and then coming to our office for us to fix it, because there's a reason why you shouldn't inject yourself at home. If you have not been properly trained or done some degree of internship, like a 2-day certificate is not.
No.
It's not training. It just says, hey, here's the safety basics, go on.
Yeah.
Right? Like, you should actually spend some time with somebody and learn, because you really are doing something medical.
Yeah.
But yeah, it's been the whole next level nightmare.